Hello. It is late in the day. On a Friday, exactly. Thank you for sticking in, and thank you, Lisa, for the presentation you just did. A lot of it resonated with me and might shift what I say today. So my name is Porsha Hall. I work for SAGE. We are a advocacy organization, well, services and advocacy organization in New York City that serves LGBT older adults. And I'll be talking today a little bit about how we've gone about engaging our folks in research. And so first, I like to start off by kind of putting the scope of why it's important to even focus on older adults in research. The population is aging significantly. By 2030, there'll be just as many people over the age of 65 as there are people under 18. That's a huge shift. The baby boomers are growing. By 2060, they'll actually exceed. There'll be more people at the age of 65 than under 18. And there are things to think about that when you're thinking about not only research, but just who's caring for whom and things like that that should be addressed in research. That applies to LGBT older adults as well. In 2015, there are estimated 3 million people over the age of 55 who identified as lesbian, gay, bisexual, and transgender. And by 2030, that number is expected to more than double. And that's just kind of a prediction. When we're talking LGBT, if you're studying younger populations, there's Q and plus and all these other intersections of those identities that aren't even addressed are considered within that estimate. So in taking that into consideration, when you're thinking of people on the older end of the life course, on the older end of the spectrum, they've gone through a lot of different discriminatory practices and throughout their history, throughout their life course. And some of them are largely invisible. They're under-researched because they're invisible. And I love this figure because it kind of puts into perspective when you think about LGBT research. I think, especially now in the times, you see more of it happening, and a lot of it's younger folks participating. And if you look higher up, there are more barriers that could necessarily impede an older individual's desire to be a part of research. Can you read that? It's like tiny. I thought you would be able to read it. So LGBT older adults. So some of those things that were discussed within the previous slide, and I'll actually mention some of them. Until 1954, the McCarthy trials targeted LGBT folks were considered sexual perverts. So that's someone, if you are 85 years old, that's something that you live through. I'll skip down to 1978. Harvey Milk was assassinated for being part of the LGBT community. And boop, boop. We'll go down. I can't read this either. It's so tiny. In 1997. And that is in line if you are, say, 45 years old. So that's not, so when Ellen came out, that was a big part of history. I think that was one of the main visibilities, and when things kind of started to shift, at least in the media perspective, when people could see a role model and things like that. But before that point, there weren't oftentimes people who were out. And so that leads to kind of the closetedness and invisibility that people who are a little older might experience. Which segues into the next slide, which is LGBT older adults are at a greater risk for experiencing health disparities. And we talked a lot about that this morning. Particularly, LGBT folks they have higher rates of chronic illness, depression, anxiety, isolation and loneliness, and premature death. They have a heightened risk of social exclusion and difficulty securing health promoting resources, and they have lower income and educational attainment. And when you're talking about research, when you're talking about how research is promoted, how research is established, and why research is needed, think about those things. If that's what people within the little bit of research is saying, that these health disparities exist among LGBT older adults. And I can speak on the fact of the research that exists doesn't necessarily have large amounts of Black and brown folks and immigrants and minorities included in it. So if you're talking about the most marginalized of the marginalized, and those are the stats that exist, they're probably within that a lot worse for people who identify as Black and brown or trans. So SAGE, is that right? Oh, no, wrong slide. So research in LGBT older adults. So it's a priority area. So people have acknowledged that there's a need for more research on LGBT older adults. The American Geriatric Society has prioritized reducing health disparities in LGBT older adults as a major public health concern. And like I said, there's just a lack of data out there currently. A lot of it's because public health studies and aging studies haven't put SOGI information in there, so sexual orientation and gender identity. People don't ask the question. So even folks who are participating in research, there's oftentimes not the ability to decipher where they are on the spectrum of their sexual orientation and gender identity. There are a lot of reasons for that. Some of them are one of them, is that people assume that folks won't answer that question, or that people are uncomfortable asking individuals that question. But when studies have been done, I just quoted some stats, so people have actually participated in that. Some of them don't mind. There's a study out now, the Aging with Pride, I'll talk about it a little more, but she's been very successful in kind of recruiting and sustaining LGBT folks across the country in research. It's Kerrison Goldstein. All right, so SAGE. We were founded in 1978. We're like I said, the oldest and largest organization dedicated to serving LGBT older adults. And we aim to lead in addressing issues related to LGBT aging. And so why that's kind of relevant is we've been doing this work for a long time. And we've been engaging LGBT older folks across the nation for a very long time. And so when people want to do research, they think about us. And we have a large reach. We offer services in New York City, but we also are a national organization. So in New York City, we have senior centers, we have care management. We're a CBO, so we're a community-based organization. And in a way, when it comes to research, we're often seen as a gatekeeper amongst LGBT individuals. The folks that people can't reach, we actually can. And not only in New York City, but throughout the country. Like I said, we have 30 affiliates ranging from Texas to Chicago. Our most recent one is in Puerto Rico. And so it's a huge, diverse group of folks that we have access to in a population that a lot of people don't and can't see and are invisible to. And so I'll speak about some of the ways we've gone about engaging our folks in research, which is one of my key roles. And so one of the things we have really worked hard to do is community-based participatory research. And today, earlier, stakeholder engagement research was discussed, and they pretty much go hand in hand. And I like to think of community-based research, the way we do it is instead of putting it on the often academic researcher or medical researcher to lean into us, I take it as we're a community-based organization. We have access to the people. We have the power, and we will work with you to do the research that we know our participants in our community need. And some examples of that are the Aging with Pride study. It's a national organization, or a national study. It was the first federally funded longitudinal national project designed to better understand the needs of LGBT elders. There's something like there are over 24,000 LGBT adults ranging from the age of 50 to over 100 that have been enrolled in that study. We were a part of that. Another one is the Age Advantage study. It's a recent study that we're doing in New York City. We're working with the Visiting Nurses Society, VNS, to do this study. And it's going to be one of the first LGBT studies in New York City. to kind of work towards figuring out what the health needs are of LGBT elders. And we've had a lot of support from our folks across, not only in New York City, but across New York City. They're very excited about this study, and people are interested in becoming a part of it. Some ways in which we've gone about incentivizing people, our folks love money. They want, when people approach us and they want to do research, they want it for all the reasons that were mentioned, the engagement and the impact and all of that, but they also know that they are a hard to reach group of people who are people often try to tap. And the culture has become, whoever gave that first $25 gift card like 15 years ago set the precedent. Our folks want to be incentivized. They want gift cards for they want reimbursement for their time, and they want travel. They want to make it as easy as it can for them, because they know ultimately it's for their good, but it's also most of the time a researcher who's gotten funded, and it's for their own prestige. They know this stuff. Also, what those incentives are vary across communities. So our folks in the Bronx are going to want something different from our folks in the Brooklyn. Our folks in rural areas are going to want something different from our folks in urban areas. And so, again, as the gatekeeper, it's on us to figure out what that is. Our folks want their finding, anything that's happening to them, they want that information to be shared. They want it to be shared with them. They want people to do that feedback loop that's supposed to happen when you do CBPR or other types of research that are community-driven. They want you to get their buy-in, okay, on what you're going to publish. That can be done with a white paper, a one-page, or a video. We've had our folks say, can you put this in a video for us so we can kind of show it around and share it with our friends on Facebook, which goes to recruitment. One of the ways in which we've been successful in targeting folks and getting people to participate in research is through Facebook ads. They don't do Twitter, they don't do Snapchat, and I think a lot of times that's where researchers go, because that works with younger populations. Our folks aren't there yet. They're getting there rapidly, faster every day. Also, word of mouth, snowballing. The more harder to reach our invisible population is, like my research personally focuses on Black lesbians over the age of 50. It's a little tight-knit group of people, and snowballing, word of mouth, that's how things like that are successful, from what we found. And inclusive flyers, oh geez. A lot of people who do research studies, you have to shoot things to the IRB, and they get accepted, and that comes set in stone. But if afterwards you want to include LGBT folks, but your flyers and promotional materials don't have that representation, odds are folks know it wasn't for them, and they're going to be disconnected. I'm at time, and I'm done. So any questions or comments? Thanks.